Marakwet and we've been to Ziwa. There are a few challenges here and there, but there is so much congestion at Mtrh, especially because of the facilities they have, and also the county government does not have county referral hospital. And I think it's a matter maybe we need to pick up as a Senate to see whether the national government can establish a county referral hospital so that we decongest Moi teaching referral. For Ziwa, which is under county government, they don't have a theater, which needs to be put in place. And we have discovered through this trip that there is no proper recording of the equipments, because some of the equipments that are supposed to be in Ziwa, they are not there. Some of the equipments that are actually in record that they are at Ziwa, at Moi Teaching Referral, they are not at Moi Teaching Referral. So this is something that we really need to correct so that we have the right equipments within this institution.
We were in Ziwa again to visit and see the equipment that was brought and whether we can actually transition Ziwa from a health center to the level 5 that we need in this county. The buildings are coming up, the equipment is there. It's only that, as we discovered today, some of the equipment that was supposed to be in Ziwa did not actually go to Ziwa. It is supposed to have come to referral in the documents that we received from the ministry. But when we reach the referral, they are not even here. What was given to referral belonged to referral. So those are some of the things that we are trying to go and clarify after this visit by the ad hoc committee on mess.
It's good to purchase those equipments. Some of them don't necessarily need to be leased. Why do you lease a trolley? Why do you lease a trip stand? There are certain things that we can talk about leasing, but there are others we don't need to. And in any case, it's better to have them bought once, because when we did our own survey, the amount of money we pay per year under the leasing service could have bought us all those equipments with change remaining. So I think the ministry should rethink, and the monies given to directly to what the money county have, they can have those buy those equipments from the market and be able to run, just the way we have been some counties in the past. We have been running theaters, and those things have been working.
In the county facilities that we have visited, we are still grappling with challenges of equipment that was supplied and has not been utilized, not exclusively because of the fault of the county governments, but because perhaps the needs assessment before the supply of the equipment was done did not go on well. And so you have facilities, you have equipment that has been supplied to the facilities, and the facilities have no sufficient infrastructure to operationalize those equipment.
When you go and see at ICUs, HDUs, they are full. When you go and see, when you go to the dialysis center, they are full. And the theaters are full. So we need more manpower to be employed. We don't see the need why we have doctors who are consultants, who have graduated, and they are hanging in the streets. This hospital, among others, should be supported to have adequate staff who are the trained manpower.
We want to pursue a win-win situation where we look for ways of strengthening this facility, but at the same time strengthening the other facilities at county level, so that the outpatients do not have to really walk in here, so that this is left for teaching and referral cases. And then the county facilities can deal with walk-ins, and that really will improve efficiency in medical services in this region.
This was a very great visit, really, so that they can ascertain for themselves that the managed equipment service program, with the right structures in place in terms of human resources for health, leadership, governance, and management, can work. And I think they will be able to say for themselves, and you heard Senator Wambua when he spoke on behalf of his colleagues, that that is the case here. And I think this also can happen in the counties when they are facilitated to have good hospitals with human resources for health, inadequate numbers, inadequate cadres. So we want to just say that we need more. Like the chairman has said, we need more equipment. What we have is not adequate for the population that we are serving.
In cases of this case of nephrology, kidney issues, NHIF covers part. We need initial tests, the operation, and post-operation care, which is more expensive. We need to urge the government that NHIF should be a package where you take care of the patients when they go through the tests, the operation stage, and post-operation, because what remains is more expensive than actually what the NHIF is covering. So if we are able to say we are addressing challenges of kidney problems, we need to get that NHIF should cover the entire package. Or when you have a package of the NHIF, it covers the whole chain.